Have you ever sat down to relax and watch some TV, but you start feeling this strange sensation? Or laid down on the couch to take a break from a long day, still experiencing this annoying feeling? Or even drawing to distress your mind and enjoy making something interesting, but you still feel this dryness? You may be suffering from what's called dry eye. Most of the time, you could fix this by applying artificial tears to your eye. Sometimes one eye has normal tearing, but the other doesn't. Dry eye is also a possible side effect of refractive surgery such as LASIK, what my dad does. However, there are people that suffer from chronic dry eye and need a punctual plug placement. This comes in two types. The permanent punctal plug can last several years, and the collagen punctal plug can last around a couple of weeks to a few months max. The collagen punctal plug is more like a tiny thread device made from collagen to offer temporary relief depending on the severity of your situation. This is the one used to demonstrate the procedure. The closure and blockade that the plugs make conserve both your natural tears along with sometimes some artificial tears you might use. The puncta are 4 very tiny holes located on the side closer to the nose. 2 puncta per eye, one on the upper eyelid and the other on the bottom lid. The punctum is opened and therefore doesn't stop tears from being released from the canaliculus or tear duct in order to work properly. A typical punctum hole is able to open and close on its own. Now that you have a better understanding of the punctal plugs and dry eye, you'll need a couple of tools for the procedure. The first thing you'll need is the forceps. This is used to grab and take out the tiny plugs. Secondly, have your locking needle holder. This is used to hold the plug when you place it into the punctum. Then you need the punctal dilator. This is used to enter the punctum and widen it to place the plug inside. After that, you need the punctal plugs. The one used for the demonstration is the temporary collagen punctal plug. A small paper towel is used to clean off the anesthetic drop when it drips. And most importantly, you need a specialist eye doctor. Typically when dealing with such small devices, the doctor would use a scope to help him better view what he's doing. But with the amount of experience and expertise, my dad just eyeballed the entire procedure. This is a close-up of the tiny blue plug. Even with the extremely tiny size of them, one single pair is around $80 to $100. Behind it is the tip of a small sewing needle, and above the needle is the punctal dilator, which is going to open the punctum. The largest thing displayed is my left pointer finger. The image is so zoomed in, you can see the minutia, or dermal ridges, aka the fingerprint. And finally, behind my finger, you can see the locking needle holder. This will be used to put the plug in the punctum after using the punctal dilator. You also want to have this second most important item that's different from the actual metal tools. It's more of a protective item. This is one material you don't want to forget. You actually can't do any eye procedure without this guy. This is the lifesaver because it's not only preventing the pain, it also cleans and reduces infection and bleeding from the invasive procedure. Without this, you would feel the super hot cutting lasers in your eye internally, or a small scalpel cutting the entire lens or outer layer of the eye in half to remove a bad cataract. Or even if you need all these different cutting, stinging, slicing, puncturing, ripping, or even burning operations for one or both eyes. Imagine the pain you would feel with a small metal needle opening your punctum and moving around inside your eyelid to widen it as well. What's this miracle item to save you from all this pain you'd otherwise feel? This is what's called the anesthetic eye drop. The specific anesthetic eye drop my dad will use is one of the best and is called proparacaine altifluorobenox. Now on to the actual procedure. First, you need an eye drop of the anesthetic to prepare the eye prior to the surgical procedure. This is demonstrated with the point of view. You'll typically get an average eye drop placed right on top of the iris and pupil to allow a slow, evenly distributed amount. However, that puts it on the bottom eyelid to allow a quicker release and even easier distribution around the eyeball. Now you have to move your eyeball around to spread the fluid evenly amongst the eyelid. This is what you'll see after you finish spreading the proparacaine around inside your eye. You will feel the thin sticky layer at first, then suddenly the feeling in your eye stops and you won't feel anything painful anymore. Notice how the pupils dilated as well. This means your eye is responding correctly to the anesthetic and it's now time for the first puncture to your eyelid. Here the puncta is popped open. Listen. This is the second shot displaying the eye so you see what is done using the first metal tool, the punctal dilator. Listen. After the punctum is popped open, the punctal dilator is inserted into the punctum opening it made. It moves around inside the tiny opening to dilate the hole and increase the space for the plug. Then, with the needle holder, you hold the super tiny collagen plug. You really have to understand just how tiny this device is. And then you insert the collagen plug into the dilated punctum hole. After setting the plug into position, you use the needle holder once again. This time to push the plug deeper to steady it. Now once again, use the punctal dilator, but this time to push the plug into the final place internally within the eyelid. Then you're good. This is the wrap up of the punctal plug procedure. I really hope you enjoyed it.